You walk into your patient's room and they tell you they feel short of breath. What do? Sit the patient up so they can fully expand their lungs to promote better breathing. While doing this, quickly assess the patient. How do they look? Do they have labored breathing? Has their level of consciousness changed from your initial assessment? If the answer is yes to either of these, this requires a notification to the provider and possibly calling an RRT. Check a full set of vitals, including O2 sat, heart rate, and blood pressure. If the patient's oxygen saturation is low, apply supplemental oxygen. Important to note that if the patient has COPD, the recommended O2 saturation requirement is usually lower, and O2 needs to be managed carefully to avoid CO2 retention. Then listen to their lungs to assess for abnormal lung sounds like crackles or wheezing. Next, I'd want to assess for the cause of this event. Did the patient just ambulate? Do they have excess secretions? Are they in pain? These are all factors that can prompt shortness of breath, which all include different interventions. I'd make sure to reassess my patient after I've implemented any intervention and alert the provider of any changes. If the patient's condition doesn't resolve, the provider may order other tests or medications based on the patient's history and condition. I hope you found this helpful, and please comment below with any other clinical situations you'd like to see covered.